And welcome to the chat of Northern Virginia and DC chapters 2024 ADHD Resource Fair and Virtual Lecture Series, which is highlighting ADHD Awareness Month. I'm Pam Thomas, coordinator for the chapter, and I'm so very glad to have you all attend this second of 3 virtual lectures in our series. And this one is entitled, We Have So Much in Common, Understanding the Overlap and Distinction between ADHD and autism spectrum disorder, with our guest lecturer, Dr. Karen Ewart, founder of the Sycamore School in Arlington, Virginia. So a little about our chapter. The CHAD of Northern Virginia and DC, is one of many chapters in the CHAD National Organization, and as such aligns with the national mission of improving the lives of those affected by ADHD. We are a volunteer organization of trained professionals who offer support in a number of ways. In addition to offering these free ADHD virtual lectures and in-person resource fair coming up on the 26th, which is Saturday, the 26th of October, we also host a monthly lecture series on the second Tuesday evening of most months and provide support groups for parents and adults with ADHD. While we are all volunteers, we cover expenses through membership, dues, donations, and sponsorship. So please consider becoming a member and support our work. We're very, very grateful for our sponsors that are supporting us for this 2024 ADHD Resource Fair and Lecture Series. And I'd like to take just a few moments to highlight our gold and our silver sponsors today. So let me just get that rolling here. Okay. All right, McLean School was one of our gold sponsors. McLean School understands students first for what they can do, not for what they cannot do. This abilities-driven approach enables bright students, including those with dyslexia, ADHD, or organizational challenges, to be successful in and out of the classroom. For 70 years, they have helped kindergarten to grade 12 students realize their full potential with a comprehensive college preparatory curriculum that is traditional without being rigid, challenging without being intimidating, and designed with real-world success in mind. So success at McLean is rooted in the understanding that the very qualities of mind that render traditional teaching approaches unsuitable for some students are actually the flip side of tremendous strengths. Students can be resources of creativity and insight if only we begin with can rather than cannot. And that is McLean School. Our next goal is Thrive Emerge. Thrive Emerge is a pioneer of comprehensive wraparound programming to help struggling to launch neurodiverse young adults and their families transition into independence. Since 2004, their mission has been to help older teens, young adults, and adults recover their confidence and develop skills to succeed in life. Thrive Emerge helps neurodivergent teens and young adults who are struggling to launch. Adults with ADHD and executive dysfunction, autism spectrum disorder, and mood and anxiety disorders, and teens and young adults with substance and screen overuse challenges are all addressed in the Thrive Emerge services that they have. Silver sponsors, we've got Activate Education and Psychological Solutions. They offer comprehensive psychological and psychoeducational evaluations for youth seeking admission to private or independent schools. Social skills, they also offer social skills training for youth with interpersonal skill deficits, psychological consultation for clients, professional colleagues, and schools. Educational consultation to address children's needs in school, at home, or both, tutoring, academic skills training, and executive function skills, college and career counseling, speech language evaluations, and speech language therapy. That's a lot. Whew. College living experience has been the gold standard in helping neurodivergent young adults thrive for over 35 years. With their immersive traditional program and flexible day programs, students receive customized coaching in social skills, independent living, academics, career readiness, and executive functioning. Whether on a college or career path, CLE equips participants with the tools that they need to succeed and proudly support those with diagnoses such as ASD, ADHD, nonverbal learning disabilities as well. And then we have integrated Integrated Psychology Associates of McLean, a shared endeavor in collaborative and integrated care by Eva Marie Theodosides. Theodositis, I'm sorry, I'm not really good with that, and Deborah Brosius to provide comprehensive services to McLean and its surrounding communities. Along with their associates, they offer comprehensive services to meet the psychiatric assessment and therapy needs of our diverse community. Learning RX is, I believe, well, we got lots going on. Learning RX in Reston is one-on-one training programs perfect for kids, teens, and adults, focused on mental exercises to strengthen core cognitive skills like attention, processing speed, and working memory. With a unique approach for each learner, their trainers keep sessions fun and challenging. Learning RX Reston works with learners of all ages and abilities. Their trainers can help students with dyslexia or other cognitive challenges as well. And so we're getting down to the final ones, I promise. We're very grateful for our other silver sponsors, which is Pathfinder Coaching and Tutoring. They have been providing exceptional coaching, tutoring, and IEP 504 plan consulting services since 2005. It is committed to supporting its clients each step of the way as they pursue their own unique path toward success. Pat Hudak, internationally recognized professional and board certified coach and owner of Pathfinder Coaching and Tutoring, has worked with students of all ages and their families with an emphasis on supporting children diagnosed with ADHD and their parents. Adults with ADHD have found coaching support in the areas of time management, workplace issues, and relationship challenges. And academic tutoring support is available in the areas of homework help, time management, and developing effective organization and study strategies. And we have Cortona Academy, provides an unparalleled approach to college prep by using a proprietary teaching process honed over its 32 years history with a collaborative approach between tenured staff and professional educators, personally committed to each student's success and happiness. Their dedicated parents and the students, the goals are obtained. Cortona Academy celebrates the accomplishments achieved by their graduates who all reach their utmost potential and enter great colleges with scholarships to boot. Commonwealth Academy, a college preparatory school that embraces students of average to gifted ability who have ADHD, executive functioning challenges, and mild learning differences, was founded on the fundamental belief that bright students who learn differently can perform at the highest levels when presented with strong, engaging, and responsive programs. They empower their students to thrive and discover their path to excellence with small class sizes and differentiated instruction in an inclusive and nurturing community. For more than 25 years, Commonwealth Academy has delivered on the promise and provides students with unparalleled college preparatory experience that is empowering as much as it is education. Thank you for your patience, for all those like little bios on all of our wonderful sponsors for this resource fair and all through the lectures. I'm going to turn it over to our wonderful guest lecturer, Karen Ewart, who's going to take it from here.
Excellent, thank you. All right, can everybody see my screen and the slideshow? Hopefully, yes.
Yes.
All right, excellent. So thank you for joining me this evening. We'll be talking about how two really interesting neurodevelopmental disorders, their distinctive features and their overlap. So we'll be talking about ADHD and autism spectrum disorder. Just to give you a little background, I am a clinical psychologist, but I've worked in schools my whole career. Early on, I actually made my way through grad school by being an ABA therapist. And I also worked helping kids who struggled with reading, so kids with dyslexia. And then once I received my PhD, actually my dissertation was around parents' experience of having a child with autism. And then I was immediately in school as a therapist and then clinical director. And I've worked in several public and private schools in the area, always working with kids who are neurodivergent. So I have a pretty extensive background working with kids who learn differently. And it's been an amazing experience just getting to know a wide variety of students and also seeing the evolution and the increase in understanding of the complexities and intricacies around these diagnoses and disorders and how we can be supportive in working with these students. So just to get started, just to give you an overview of what we'll be discussing, we're going to be going over what is autism spectrum disorder, what is ADHD, what things set them apart, how much overlap they have. We're going to be also talking a little bit about executive functioning skills because that's a really important component of both disorders. We want to talk about comparing, contrasting how a lot of times these kiddos struggle with similar things, but for different reasons. And then we'll be talking about supports. And finally, positive attributes, because these students can be really gifted and have some really unique positive qualities that they bring to school and they can bring to the job and to their friends and family. And then I'll end with just sharing some resources, and we should have plenty of time for questions. So to start with, what is autism spectrum disorder? Um, it is a neurodevelopmental disability, and the hallmarks of it involve both social, communication, and behavioral challenges. It's one of the things I think that's always, um, I think, been interesting for people is that individuals with autism can be in our community and around us, and there's nothing that really separates them sometimes initially in terms of looking different or sometimes even presenting differently. But when you get to know individuals better, how they communicate, interact, or learn can be different from a kiddo who's neurotypical. And it is a spectrum disorder, meaning that every kiddo on the spectrum is different, but there's a huge range of ability within that umbrella. And we'll talk about that. Also, it used to be that there were separate diagnoses of autism and Asperger's and PD and OS, and now it's under this umbrella. And so all these are under this whole spectrum um, disorder diagnoses. And it can impact individuals of all ethnic, racial or economic groups. And although it is something that is neurodevelopmental, meaning that individuals have it from birth, but there are treatments and there are services and there are skills that these individuals can acquire that can help them in their functionality and really help them um, in their lives and in their ability to interact with others and to have productive, full lives. So when we're looking at ASD, there's two areas of impairment, and one is around social communication and interaction. And so the first is this idea of reciprocity. So reciprocity is in a conversation, there should be a give and take. So, except when you're doing an evening lecture, no. But in general, the idea is that when I'm having a conversation with somebody, I might say a few sentences and pause and give space for the other person to speak. And if they don't speak, I might ask them a question. So it's that awareness and that understanding that a conversation is two-sided. Individuals on the spectrum often don't recognize that, and sometimes it feels like they're talking at you. And so they'll talk at length or very excitedly and may have a very rich vocabulary, but it's all about something that's of intense interest to them. And a lot of times kiddos on the spectrum too will be much more comfortable speaking with adults, or say a lot of times I'll hear, oh, well, they're really social, but it's mainly adults. And that's for a lot of reasons. And one is that, frankly, adults are much more willing to be a listener for kids than peers often are. And so sometimes, again, we see this hallmark of talking at somebody. Um, the other one is the idea of nonverbal communication. So kiddos on the spectrum don't read nonverbal cues well. They don't look at faces, they don't look at body language, and so they miss a lot. And they also don't use it themselves. Like kiddos on the spectrum often don't use hand gestures or any other things to aid in their speaking. Um, and then the last piece on this is that idea of maintaining, developing and maintaining appropriate relationships. So it can be very difficult for individuals on the spectrum. A lot of them, maybe they initially will make friends with somebody or be okay, superficially, but it can be difficult for them to maintain it. One, because a lack of awareness in terms of perspective taking, also understanding cause and effect. Um, I've seen kiddos who parents have a play date and they pick an activity that both the kids really like, and then all of a sudden the kid on the spectrum is done playing, so they just walk to their room and the other kid's just sitting there thinking what's going on, but no awareness of that idea of I should be engaging with this person, and then just getting up and leaving is not going to ingratiate them to me. Um, in terms of respect, and oh, I should go back. All three of these need to be present. So that socio-emotional reciprocity, that nonverbal communication deficit, and that difficulty forming and maintaining appropriate relationships, those all need to be present for the diagnoses. And then when you look at the restrictive and repetitive patterns of behavior, you want to see two symptoms in these domains. So the first is that idea of repetitive or stereotyped movement, speech, or play. I've seen young kiddos on the spectrum. Sometimes you'll see their play looks really regimented and sometimes almost obsessive compulsive. It can be lining things up or sorting things. And it doesn't have an imaginative quality to it. And it often isn't interactional the way that you see with neurotypical kiddos. Stereotype movements can include what's called stimming. And so stimming is when you'll see hand flapping or pacing, doing something repetitive that is actually soothing to them. In terms of speech, some kiddos on the spectrum have very monotone speech. Some can be speak too loudly, others can speak too softly. Some of them have a weird inflection when they're speaking. So that can be something that you see. Another one, a big one, is that insistence on sameness. So really wanting routine, ritual, and needing advance notice of changes in routine. So transitions can be really difficult, and really gaining comfort from knowing what to expect and having a routine. And when you don't have the routine, it being really upsetting. Another is this idea of limited and intensive interests. Um, there's stereotypical ones, but they're stereotypical because they're popular. So things like trains and planes, it seems like different modes of transportation. It could be maps, it could be travel, it could be, I've seen kids be really interested in like World War II. So it all depends on the child, but they'll have these interests that they just can be all consuming. And to the extent in which, if it's not an area of interest, they don't want to engage with it. The other piece is either over or under sensitivity to sensory experiences. And you'll hear these terms sensory seekers or sensory avoiders. And so some kiddos are very sensitive to touch, or maybe the light touch is really aversive, but deep touch is okay. Some kids actively seek out stimulation, and some kids avoid it. So you'll see some kids that loud noises really bother them, or entering a room that feels chaotic can just be completely overwhelming. Um, so paying attention to a child's sensory experiences is another important component. So this is just, and this is more for you guys, I'm hoping we can send out the slide deck afterwards. It's just breaking down the things that I already spoke about. So these are the communication and social interaction deficits that I just went over. And these are those restrictive or repetitive behaviors. So it's just giving you definitions for the things I just discussed. The idea with this, and you'll see this with pretty much most disorders, the idea is that symptoms need to be present across settings. And so the idea is that you see it at home and at school. Um, and you hear my dog barking in the background, of course. So the other is with autism that it's this idea of that there's level 1, 2, and 3, level 1 being the highest functioning, and level 3 being the least function, or the most, having the most severe impairment. And so this is just a visual that's outlining that. I have to say, I don't love this for a lot of reasons. It is interesting. That's a whole other topic, is the idea of the DSM and how it changes. So it used to be that, again, autism was a separate diagnosis from Asperger's, from PDD, NOS from another, and now it's combined into this umbrella, and they have these levels. You used to hear about high functioning versus low functioning, and now people come and they'll say, oh, my child has autism, but it's level 1. And it can be confusing for people because the levels really refer to the severity of the symptoms that are hallmarks of autism. They're not really talking about things like intellectual capacity or other things that might serve as functionality. So again, I don't love this, but this is something that now is used as part of the diagnosis that's supposed to say how severe are the symptoms. But I know kiddos who are very bright and maybe very functional in some ways, but really struggle with social deficits. So are they level 1? I know other kids who maybe don't have as much of the trouble with organizational skills, but they really have trouble with socialization or with conversation. So it is interesting to me because, and again, I'm not working across contexts. I haven't worked for a while for kids who are nonverbal, have cognitive impairments, and are autistic. But I will say that the kiddos that I see, everybody's like, oh, my kid is level 1, as if it's mild. And I have to say that even kids that are labeled level 1, some of the things that they encounter aren't mild, and they pretty significantly impair their socialization and their ability to be present and engaged at school. So just my little piece of, I don't love these levels. The other characteristics of ASD that can be present but don't necessarily have to be are there is a subset of kids on the spectrum who have language delays. So when they were young, they might have had delayed language, difficulty speaking. So they may have needed speech and language services. And in the past, that was something that kind of differentiated high functioning autism from Asperger's. But now some kiddos on the spectrum can present with language delays, while other kiddos have no language delays. And it's similar with other developmental delays. Some kids on the spectrum could delay in terms of motor skills and have like have motor coordination disorders. Others don't. Some kids on the spectrum are delayed cognitively or even can have cognitive impairment, while other kids on the spectrum can be of average intelligence or even gifted. I highlighted this next one because this is a big overlap with ADHD, is that both individuals on the spectrum and individuals with ADHD can present with this hyperactivity, impulsivity, and or inattentive behavior. And then you'll see other things that are just like related, and we'll talk a little bit later about that, of there's kind of a constellation of mental health and even physical conditions that seem to go with individuals who have autism, including like picky eaters, and difficulties with gastro issues, mood disorders, difficulty sleeping, seizure disorders. So those are things that sometimes we see in clusters, that kids with autism are more likely to also have some other we think they are related disorders to autism. Girls can be especially tricky to diagnose and can present really differently. And also, one of the pieces is that individuals with autism, because they're such concrete thinkers, can be misinterpreted as being oppositional and defiant. So sometimes kids, they're asking the why, or they're saying something that the adult, especially the teacher, may think is sarcastic or questioning, but really they just honestly need to know the why. And so they're asking something honestly, really wanting to know the answers. They're not trying to be defiant. They're just very concrete and literal and are honestly asking questions that sometimes can upset adults. So, again, in terms of autism, we're seeing the prevalence is about 1 in 36, 4 to 1, boys to girls. But I will say, I'm guessing more girls are underdiagnosed. Yes, there's a genetic component, and so we'll see these clusters of symptoms in families. So we'll see like somebody will say, oh yeah, I had an uncle that we always thought was on the spectrum, or I have one family member who has OCD and another has Tourette's. So there's these clusters of mental disorders that kind of go along sometimes in families with autism. Um, it's thought to be not just one gene, but a cluster of genes. Um, and the idea of heterogeneous is also that it's heterogeneous in terms of functionality, and that you have some individuals who are on the spectrum that are very high functioning, very capable, can hold high ranking jobs, be independent, have families. And there's other individuals with autism who are severely impaired, nonverbal, can't live independently. So it's quite a range of functionality. Um, it used to be thought that most individuals with autism were intellectually impaired. They have found now that's not the case, that at least half or more of individuals with autism have at least an average or above IQ. I think that's probably due to one, we understand autism better. I still think that, and the research shows us they still think that individuals with average or above IQ who have autism are most likely to be underdiagnosed. And so there probably is more of a prevalence than is reflected. Um, and it's also an issue too of educating our clinical community. I've really seen a lot of clinicians make a point of educating themselves and keeping themselves up to date so that they're able to give it accurate diagnosis. And unfortunately, all clinicians do not. So that's another thing, is going to a clinician who is adept and understands fully what autism looks like, and the research and what we know of autism today versus 20 years ago. So I think proper diagnosis is essential, and our clinicians also need to be up to date on what that looks like. So this is what I'm talking about when I'm saying this is what autism is, and these are conditions that are related to autism. So when you look at the purple and the orange, the purple, these are our two big hallmarks of autism, those social communication deficits, and then those behaviors, um, uh, and sensory sensitivities. So restricted behaviors, restricted interests, those are the two areas that are hallmarks. And then underneath, when you look at intellectual ability, language skills, and adaptive functioning, it's showing you that there's a range. So that individuals on the spectrum really can be quite verbal and even gifted verbally, or they could be nonverbal. In terms of intellectual ability, they could be ID, which is what we call intellectually delayed or deficient, or they could be gifted. Some kids can also be gifted in one area and have a learning disability in another area. So you can see scatter. In terms of adapted functioning, again, some individuals on the spectrum are completely independent, successful, brilliant, and others need help, need support, or maybe brilliant and they need help with independent living skills, or they need help with kind of the mundane everyday things, and yet could hold a very sophisticated job in a specific area. So sometimes you see this, actually, you usually see this big um, split between intellectually what they can do and socially and functionally how they interact with our larger world. And so a lot of the supports we're giving them are helping them raise those social skills and that how we interact with our larger world. So moving on to ADHD, attention deficit hyperactivity disorder. This is another disorder that has evolved, or that we look at it a little bit differently now. It used to be that it was separate, that you had ADD that was just inattentive, and ADHD that had the hyperactivity. And so now they've combined it, that we say it's ADHD, but they're different types that we'll talk about. But the hallmark of ADHD is the presence of inattention and possibly impulsivity and hyperactivity. So those are the three core symptoms. Um, Roughly 10% of our population exhibits ADHD. It is most prominent in our youth. And so it can be up to 11% in individuals 5 to 17, but adults, it's down to 4%. And I think it's a couple things. I don't know if it's something you grow out of, but I think that individuals with ADHD learn adaptive functioning skills. They learn how to manage it. And frankly, a lot of adults who haven't been diagnosed as kids, I think just never get diagnosed. And so I feel like there's more of a move to get diagnosed as an adult than there used to be, but I would still hazard a guess that there's a lot of adults who have ADHD but have never been officially diagnosed. It is 2 to 1, boys to girls, and boys are more likely to present as impulsive and girls inattentive. And once again, that means that boys are more likely to be diagnosed, maybe even overdiagnosed, because if an individual is in a classroom and they're behaviorally acting out, blurting, not able to sit in their seat, not able to follow directions, the teacher's going to flag it, it's going to flag the parent, and it's going to be addressed. But if an individual is daydreaming or just kind of, zoned out, much less likely to be flagged and those symptoms really addressed. So the inattentive, I think, takes a little bit more to diagnose than when you see kids who are hyperactive, impulsive. And a lot of times too, you might see it later. So you might see somebody not getting diagnosed till they're older because it wasn't flagged as disruptive or as problematic. So like ASD and like most disorders, you want to see these symptoms happen across settings in order to diagnose it. And the idea is that there are 3 types: predominantly inattentive, predominantly impulsive, or combined. So this is just a visual. And so individuals that are predominantly inattentive, it's really, it can be more, it's more passive. I remember an individual at my school, and he would stand out at the window and he'd be looking outside the window, and the teacher would be like coaxing him over saying, "Hey, it's time to do math." And he was like, "Oh, okay." And he'd go on over, and then we're starting math, and all of a sudden he has his pencil, and his pencil is fascinating to him, and he's looking at his pencil and just mesmerized by it. And the teacher's like, "So, hey, here's the math problem. This is what we're doing." And so it was this, again, it wasn't impacting other people, but he really struggled to focus or attend to what he needed to do. Um, then versus predominantly hyperactive impulsive, these are kiddos that seem like they're like Energizer Bunny. So constantly on the go, often needing to move. You might see the knee that's constantly going up and down, fidgeting a lot, can be really impatient, can blurt. And so again, how they present is much more outward, and so is more likely to be flagged. The combined type is the idea that they have attributes of both. And so if you are combined type, it means that you have criteria of both that inattentive and that hyperactive impulsive. And this is just listing the criteria, and I'm not going to go over all of it, but the idea is that this form, predominantly inattentive, it's that idea of difficulty with sustained attention, difficulty adhering to the details, or making careless mistakes with tasks, doesn't follow through from the beginning to the end, um, often losing things, forgetting things, again, easily distracted and forgetful. Versus the predominantly hyperactive, you're seeing more of that outward presentation, either verbally blurting, nonstop talking, fidgeting a lot, always like asking to go to the bathroom, asking to take a break, asking to do stuff, like just seems to always want to do stuff. When you're giving the directions, the kid's like, can we just do the activity? You know, just wanting to go and do stuff, and then getting easily bored. So, this is just going over the idea of, for criteria, need to have at least 6 symptoms for that combined type, within the inattentive and impulsive categories. So, this is kind of the meat of, our presentation, is the idea of what are those distinguishing features, of ASD and ADHD and how they overlap. So with autism, distinct features of ASD, difficulty with perspective taking is huge. So that idea of really not understanding somebody else's point of view. And what's really interesting is that individuals with autism, there's a lot of misconception. Individuals with autism can be incredibly insightful when they view other people. So they can see two other people having an exchange and can totally pick up on what's happening, what's going on, be very insightful. But it's when they are involved that that's where kind of the blindness is in the perspective taking. So they can see if like two other people are arguing or fighting or whatever, they can pick up on that and see it. But it's that seeing the world only through their lens, that perspective taking, not considering that somebody else might think something differently than them. So it's like that my view is everyone's view. It's like we with neurotypical kids, sometimes you say, oh, they're developmentally egocentric. It's that idea of that we think that our view is the only view that exists. And it's not, again, it's not like from a narcissistic place or whatever. It literally is like, didn't even occur to me that somebody else would be thinking differently from me. We spoke about this before, that limited interest. Rule follower, big one. We'll use the term sometimes rules police. If you're at recess or something, a student who's really caught up in, but these are the rules and you can't break the rules and we can't do it that way, and getting really stuck on that idea of rules. Um, Echolalia is a feature of ASD. It's the idea of repeating what you've heard. And so some kiddos on the spectrum, and especially with technology today, will have kids that just recite things from Minecraft, or recite things from a movie. And you think, sometimes you think it's like, oh my gosh, this profound thing, but they're literally quoting from other from a movie or from a meme or from something they heard. And it can be problematic because A, they might not think about what it means. And also presenting it as coming from them can also be problematic. And sometimes kids inadvertently will say something that's not appropriate and they just heard it and they're mimicking it, not thinking about, again, how that might impact the listener. So that point of view. Really dependent on routines, becoming upset with change, needing advance notice. Um, we talked about before that reciprocity. That's kind of a hallmark of talking at people, not asking questions in a conversation. Difficulty reading a room. So we'll see kids with autism, and like at my school, we do morning meetings. And so, you know, I'll have my kiddo on the spectrum that's either constantly raising their hand to speak, not recognizing. And these are the unwritten rules. And there's something called the hidden curriculum. If you haven't read it before, it's fantastic. And it's a fantastic resource to go through with your child if your child's on the spectrum. The hidden curriculum is all about those unwritten rules that we have in society. And so things like when you go into a public restroom, if you're trying to figure out if a stall is empty, you look underneath for feet. You don't look in between the cracks. So that's like an interesting hidden curriculum. Nobody told you that, but those of us who are neurotypical have figured it out. Or, and maybe nobody does this anymore, but if you're at a birthday party, you don't blow out somebody else's candles on their cake, right? The birthday person gets to blow out the candles, the guest doesn't. But some kiddos on the spectrum would never know that and would be like, ooh, candles to blow them out. And then all of a sudden, that's the huge, whoa, social gaffe, that they have done that. So the hidden curriculum talks about that, and things like When you're talking to somebody, if they're leaning forward and they're giving you eye contact and they're smiling, that shows that they're engaged with you, versus if they're sitting back and looking out and leaning back and not looking, that might mean that you've lost your audience. And so again, we often have to explicitly teach individuals on the spectrum that you have to pause and look at the room and read at the room and look at those nonverbal cues. And a lot of times kids don't, who are on the spectrum, and they don't pick up on that. Sometimes they have like very ritualized ways of doing things that can feel even OCD, and there can be a code diagnosis of OCD. Um, Very literal. Um, there's definitely a higher instance of anxiety with individuals with ASD. Um, One of the things that people talk about a lot is kids with, and a distinctive factor is kids with ASD can have an amazing memory, especially long-term memory, memory for facts. I've known kids that, they know all the metro stops and they can draw you a map of how to get anywhere, or they know all the capitals of the states, or they have all this concrete info that they've memorized, but they may still struggle with working memory and be able to hold short-term working memory in their head to be able to do everyday tasks, or the sequential nature. So while they might be good at memorizing tasks, they're not as good at multi-step directions or routines. There is no cure for autism, but there's many things that we can do to help improve individuals' functionality and how they relate and interact in our larger world. ADHD, this is kind of just a review of the three different traits, and that we have the predominantly inattentive, and then we have the one that is more hyperactive, impulsive, or combined. People with ADHD really struggle with disorganization and forgetfulness, and they struggle with focus, especially with things that aren't important to them. But they do exhibit what's called hyperfocus, or can exhibit this. And so it's, if something is really interesting, they might engage on it for a long period of time. You may be able to relate with this in terms of video games. So a lot of kids, have the capacity to be on video games for hours and hours. Another hallmark feature of ADHD is also really dramatically under or overestimating time. And so, it's interesting. So kids, I remember a kiddo, they'll say, dinner's at 6 and it's 3 o'clock, and you say, "Hey, can you walk the dog?" And they're like, I can't walk the dog because dinner's at 6. It's like, okay, but it's at 6 and this is 3. And they're like, yeah, I mean, it's gonna take me that long to walk the dog. And so you have to use with them of like, well, let's try it. So set a timer, set a watch, and giving them time to really see how long something actually takes. And so, because they will dramatically overestimate that. Or things like, homework and stuff. Oh, it's going to take me forever to do this. Doing things like, let's just set the timer for 10 minutes. Let's see how much you can do then, because they really have a hard time with that. Um, And yes, the idea of mundane everyday tasks, even more, I mean, for any teenager, this can be a tough lift, but especially for kiddos who have ADHD, those chores and those rote tasks can be really, really difficult. And we'll talk later about visual schedules and such. These are just some signs and symptoms of individuals with ADHD. One thing we're seeing too also is this idea of risky behavior. So we'll see kids with ADHD, and it's not recognizing cause and effect. So kids will engage because kids with ADHD, they really like novelty. And this is one of the things that separates that idea of novelty. So a kid with ADHD gets easily bored and wants to do new things all the time, and exciting things, and kind of that adrenaline rush. In contrast, kiddos on the spectrum want the sameness and the predictability. ADHD is like, I want new, I want different, I want exciting. And that can lead to engaging in risky behaviors. And I think we've gone over a lot of the other things that are on here. So, distinct features of ADHD, and I think I probably jumped the gun with it, but saying it already, but that distractibility, um, uh, so there's the distinction with ADHD It's not that they can't read other people, it's more that they're oblivious. So they're kind of into what they're wanting to do and stuff, and they just might not pay attention to others, but it's not that they can't read others. So if their focus is turned to others, they can be very insightful. Um, One of the things is that easy boredom because they're wanting novelty all the time. And again, I think it's debatable about this idea that you can grow out of it. I think it's more that adults with ADHD learn coping mechanisms. They learn how to play to their strengths. They learn that they need to do certain things in order to be functional. Or they'll learn like what they're good at and what their spouse is good at. And so maybe the spouse is better at planning the vacation than they are. So it's also delegating and playing to your strengths. But it is an interesting thing of growing out. You might see less impulsivity as individuals get older. Um, but I do wonder about, can they really grow out of it? I'm thinking no. Um, so overlap, lots of overlap. Not going to go through all of this. I'm going to have a chart that we're going to go through next that'll make it more functional and easier to understand. But I wanted to highlight a couple things. 50 to 70% of individuals with autism spectrum disorder also have ADHD. Again, this is my bias. I do not love that they have taken out, separated ASD and ADHD, meaning there are many individuals with ADHD that don't have autism. That's clear. That's fine. I would really question how many kids with ASD don't have features of ADHD. They might not have the hyperactive piece, but they'll have the inattentive piece. So, um, I see so many times, I mean, I would say 80 to 90% of the individuals I see with autism also have the diagnosis of ADHD, to which I'm like, is it really a separate diagnosis or is it under that umbrella of autism? Meaning, if you have autism, you are automatically going to have features of ADD, ADHD. So it's a debate. Sensory issues are big with both um, individuals on the spectrum and ADHD, and can react really strongly to smells, taste, feels of things. Some kids, like they don't like anything tags and stuff, really sensitive to material on their shirts and such. And we talked about the idea of sensory seeking or sensory avoiding. It is interesting. Both individuals on the spectrum and ADHD can be sensory seeking and they can be sensory avoidant. The intense interests can happen with both, and that hyper focus can be present in both. This is a huge one. Cognitive rigidity, that black and white thinking is a hallmark of both ADHD and ASD. And honestly, this piece is the piece that we have to work on the most with our kiddos is developing that cognitive flexibility, because that is such a barrier, whether it's to problem solving, whether it's to building relationships. That's a huge piece. Um, Perseveration, so it's a hallmark of ASD. It can also be a difficulty with kids who have an attentive type of ADHD. Um, but you'll see it more with ASD. Stimming, I think of stimming as a hallmark of ASD. There has been some research that suggests that kids with ADHD also stim. I'm not convinced, except for if you call it the bouncing knee. Like, you see the bouncing knee with ADHD, okay, if you wanna call that a stim, I almost feel like it's a nervous tick. Um, but when you see the hand flapping, when you see the rocking, when you see the pacing, that's ASD. Let's see. Difficulty with compromise, that goes along with, that cognitive rigidity. Um, Also struggling with self-regulation. This is huge for both camps, and maybe having difficulty with tantrums, with meltdowns. And both populations do struggle with sleep issues. So as you can see, there's a ton of overlap. Um, so now I'm going to briefly go into executive functioning skills because this is a huge piece of both ASD and ADHD. And it's really interesting because I think in the not so distant future, they're talking about executive functioning or executive dysfunction as maybe being its own standalone disorder. Because as it is now, it's only a portion of other disorders. It's not in and of itself, but I think we're going to see it maybe come into its own as its own disorder. But executive functioning is huge. And it's all the things that we need to accomplish goal-directed behavior. So if you're planning a vacation or a birthday party or a long-term project at school, they're all the things you need. So it includes working memory, it includes cognitive flexibility, and it includes this idea of inhibitory control. So this is so important because it's the idea to focus on something and to not be distracted by all the other stuff. So I am focusing on this and I am blocking out everything else. So what are executive functioning skills? It's everything from paying attention, prioritizing, being able to start tasks and complete them, that perspective taking, regulating our emotions, self-monitoring, metacognition. Those are all executive functioning skills. I'm not going to go through all these, but these are all the different types of things that you need executive functioning skills for, of things like being able to self-advocate, teamwork, resiliency, understanding cause and effect. These are all executive functioning skills. And when you look through these, you can think about your kiddo with ASD or ADHD and how they struggle with some or all of these skills. So, cognitively with executive functioning skills, um, it impacts our working memory. So, kids with poor working memory struggle with the executive functioning skills because they can't hold on information long enough to do things like multi-step directions. Planning is another big piece. Our time management, our ability. We talked about kids with ADHD that they struggle with thinking that something takes too much time or too little time. And then the idea of metacognition. That's the idea of thinking about thinking. So it has to do with self-awareness and us understanding ourselves. And metacognition is a huge piece of autism as well, and having to explicitly teach individuals about this through things like social thinking. Things that we see that present in our behaviors that relate to executive functioning skill, that response inhibition. So basically, having a pause between a stimulus and how we react to it. How we manage our emotions, how we're able to keep our attention, initiating tasks, persisting with something, and flexibility. So with ADHD, this is a hallmark feature. Executive functioning skills, huge piece. The research tells us that over 80% of individuals with ASD also struggle with executive functioning skills. I would really say they all do, because how many kids with ASD have you met that don't have some cognitive rigidity or black and white thinking? So I feel like it's a hallmark of both, but officially it's hallmark of ADHD, and many kids with ASD also struggle with executive functioning skills. And that's important to know because this is so much a part of being a successful student, and it impacts our social interactions. I'm actually going to go through this because I'm mindful of time and I want to give you guys enough time for questions. So I'm going to go through this and not dig into this because I think we're going to tag it later. So I'm going to skip through these. All right, this is the part that you wanted, and and we're getting to finally, is that compare contrast of ADHD and ASD. So this is the idea of it impacts attention in both groups, but for different reasons. And so with ADHD, it really is that lack of focus. It's that they really struggle to maintain their attention versus with ASD, it's like they're not interested. So if a kiddo with ASD is interested in something, they can attend and sustain attention. It's not an issue of they can't. It's that they don't want to. Versus with ADHD, it's really hard for them to sustain their focus. They get easily distracted. They get bored easily. They dislike tasks that feel mundane. They have trouble listening. A lot of times they don't hear the directions. It's really hard to initiate and stay with a task when you don't know what you're doing. Um, and then with ASD, there's perseveration, which is another interesting piece. So not being able to shift. So that's a big hallmark of ASD, transitions and not being able to shift. And that has to do with that perseveration. We talked about like kiddos with ASD being good at memorization of facts, but maybe not having a great working memory. And so they have difficulty with multi-step tasks. Also, ASD, kids with ASD can have a really rich inner world. And so sometimes they're really preoccupied with the inner world. So they're not attending to our outer world. Does it mean they can't? No, but they're preoccupied within here. So they're not attending to what's out there. In terms of communication, both populations struggle with communication, but again, it presents differently. Kids with ADHD, those are kids nonstop talking, need to have the last word, blurting, interrupting people. They also can be really charming and like dominate conversation and be really life of the party. Um, they can get sarcasm, they can get more inferences, intonations, double entendres, more socially savvy. Kids with ASD, more literal, more concrete, often don't get sarcasm, often don't get inferences, and so really can struggle with social dynamics. Um, it's interesting. I've had some kids recently at my school talk about, and it was actually amazing to me. They just said, you know, I have, um, I have actually this case, the individual said, I have ADHD, and so when you guys are having all these side conversations in a group discussion, it's really hard for me to attend to it. It's really distracting because these different noises and stimuli become overwhelming to me. So that was a cool instance of the kid with ADHD saying, look, it's not just the adult saying, hey, stop with the side conversations. If you care about your peers, you'll stop because it's really hurting us when it comes to group discussions. So I thought that was a really cool point that one of my high school kiddos told his peers about, hey, I have difficulty with this, so can you respect that? Pretty neat. Um, with ASD and communication, again, there's a subset that have developmentally have language difficulties, language delays, um, and that can be a piece that is a problem with communication. We spoke about echolalia. Sometimes kids will repeat phrases over and over again, like catchphrases or their phrases. Doesn't necessarily make sense. Um, we do have some individuals who are very advanced and have a rich vocabulary and can speak very eloquently, but yet they'll still struggle with those nonverbal cues that can impact their the reciprocity and their effectiveness in social communication. Also struggle with kids with ASD expressing their thoughts and emotions. Um, and I talked about this a little bit before, but sometimes voice tone is odd with kids on the spectrum. Again, monotone or weird inflection or overly loud. Eye contact, I feel like eye contact has been one of those things that it's like, yes, it can be present in individuals with autism. It can be present in a lot of different people, anxiety and other things. And I think we've also grown to recognize when eye contact is important and when it's not, and that it shouldn't be something that we're always requiring, and the nuance of it. Because if you are unwaverly, let's see, if you are constantly giving somebody eye contact, it can be creepy. So it's also the nuances of it and teaching kids how to glance up or how to occasionally give it, but they don't have to like be staring, you know, with unblinkingly to their teacher. So again, we've learned some nuances of how to teach it in a way that doesn't seem odd. Um, Routine, structure, and behavior. So this is an interesting compare contrast in that kiddos with ADHD can become bored, like novelty, like doing new things. They don't necessarily like order and repetition. Chaos is sometimes attractive. Um, do struggle with organization. Kids on the spectrum, they're like, I love it, routine. I love sameness. I love knowing what to expect. So there's a real compare contrast there. Liking routines, routines make them feel safe versus, ooh, I want something new and novel. So that's a real compare contrast. Um, let's see, a lot of this stuff I've gone over. Um, Social interactions. Um, Kids with ASD, again, can be very socially savvy and can be very quick with responses and with the popcorn of conversation. So they actually can do very well. In contrast, sometimes um, kids who can't follow it can be really left in the dust, and it can be very distracting when lots of different people are having different input. It can be overwhelming and distracting. So I would say, in general, kiddos with ADHD can actually be one of those charming or very good conversationalists. And sometimes individuals with ASD, they can talk eloquently about something, but that give and take conversation can be more difficult. And also all the nonverbal cues and all picking up on the room, that's difficult. ASD also understanding slang, double entendres is difficult. And then sometimes there's just less social awareness and kind of the nuances that go with things. Like, one of the things that's so hard is different rules. It's kind of part of the hidden curriculum, but different rules for different relationships. So, like, if I'm friends with somebody, we might call each other things that are even might sound insulting, but because we're friends, we throw that back and forth. But if somebody comes to us and is not our friend and tries to do that with us, it's offensive. To somebody on the spectrum, that doesn't make sense. Like, why would you do that? To some adults, it might not make sense either. But there are those things, those nuances. Why can some people say things to each other and they can't? I come in and try to do the same thing and they don't like it, but they like it when they do it to each other. That's very confusing with the individual on the spectrum. Uh, Social impact. So for both populations, they can struggle socially. It can be hard to make and maintain friendships. A lot of kids with ADHD get negative feedback, or they get labeled the troublemaker, or the kid that can't sit still or follow directions. So they can get a bad rap, and it can be really disheartening. Um, and so it is helping them feel like they have strengths, that they have things that they are good at, that they have actually some abilities that are pretty cool that they can bring to the table. Because sometimes kids with ADHD get really discouraged in being labeled as bad kid, and they're not, they're no bad kids. Um, with ASD, it really a lot of their struggles with social emotional impact are around that social understanding, their difficulties with communication. Um, and sometimes they're doing things that are odd. And so when you have peers that are insecure themselves and going through adolescence, sometimes looking different can isolate you, or acting different can isolate you. And so that's difficult too, to help kids with ASD navigate the sometimes very cruel social landscape of adolescence. It can be really difficult. A lot of kids with ASD, they want to make friends, but they don't know how. And again, the nuances of it all are just overwhelming. Um, the other piece is that sometimes kiddos with ASD, they really need time to recharge. And so sometimes parents are like, "Ugh," they get home and they don't want to do anything. They don't want to engage. I want them to be social, but they're exhausted. They've been at school all day having to interact and sometimes mask, and they need time to recharge. So let them recharge. It's okay. Let them do a preferred activity. Your kid wants to read for an hour, let them read for an hour. Um, and that's a whole other topic, is the idea of masking, which we're learning more and more about, is that when kids who are neurotypical try to fit in and try to do things so that they are part of the group, it can be exhausting. So working with kids on the spectrum, we really want to think about, to what extent do they have to or need to mask, and to what extent can we accept them and can they do things as they are? And it also depends on your social climate. Like at my school, if a kid wants to pace or flap, who cares? And I have a community that's very inclusive. At other schools, that could be like a social nightmare. And so that's the thing, is that in different settings, things are acceptable, not acceptable, and that's difficult to navigate. So some supports that work for both ASD and ADHD. Front end expectations. Well, for any individual on the planet, clear rules, expectations, daily routines, that helps everybody. Scaffolding tasks, breaking things down into smaller chunks so it's less overwhelming. Visual prompts are really great. Like if you have chores or you have routines at home, you're trying to get your kid to do them, having a visual of it, like have a visual of the morning routine that your child can look at, really helpful. In terms of homework time, again, I would do things like, let's work on it for 10 minutes, take a break. A lot of kids that sustained attention is difficult. So just saying, and it also feels less overwhelming if it's like, I just have to do this for 10 minutes. So breaking things down, having a set area where kids do their work that's uncluttered, that they know that they go to helps as well. Um, you have to, and this goes for all kids, you have to figure out what's the right stimulation for your child. There are some kids that want go, 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 go. And they want to get home and play on the playground. And then they want to go to soccer practice. And then they're going to eat dinner. And then they're going to go play Fortnite with their friends. Like they're like activity, activity, activity. And they're a high activity kid. There are other kids that if they have one thing that they're doing after school, that's it. And that's all they can handle. And we have to honor that as a parent, and it's hard when your activity level and your kid's activity level isn't the same. So when you've got like a high activity kid and you're not a high activity parent, or the reverse, you're a parent who's like, go, 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 and you want your kid to go, 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 and your kid does not. So it's honoring and really paying attention to what's the optimal amount of stimulation. I know you don't want your kids sitting at home doing video games from 3 to 10, but do they need more quiet time? Is it going for a walk with them, getting them outside, but then reading a book, having a talk, doing something calm at home? Like you have to figure out how to match your child's level of stimulation and account for recovery time. Another thing is really important is to model out loud your thought process. Again, with all parents, whether it's, gosh, I have this meeting that I'm supposed to go to tonight, but I am feeling really under the weather. I don't know. You know what? I'm going to stay home and take care of myself. I'm going to go to bed early and then I think I'll feel better tomorrow. Or whatever it is, model your decision-making process, model your thought process, whether it's taking care of yourself, whether it's working through a problem, whether it's emotional regulation, whether it's problem solving. You talking out loud and showing how you do that really helps your child. These are some things, just things you may have heard of the idea of a sensory diet. So some kids require movement throughout the day to help them stay regulated. So you'll see like some kids going to do push-ups or doing some things even at their desks that they do, and it's regular physical exercise and stuff, and it helps them stay regulated. And it's something an OT can help with too. There's ways that you can work with your kids on cognitive flexibility and make a game of it that are really helpful. Social thinking, if your kiddo has ADHD or ASD, you need to engage in social thinking. Great resource. A lot of therapists work with it, and it's such a great, um, it's a must for kids who are high functioning on the autism spectrum or have ADD, ADHD. It's a really great modality of working with this population. So if you don't know about it, find out more about it. There's tons of resources. I think I've gone over a lot of these, but they're just different types of supports that are helpful. And then specifically for ADHD, these are some things to do that help students. And I will tell you that 60 minutes of exercise is key. And woo, tons of supports I put for this. Like I said, I can send you guys the slides, but a lot of things that can help kiddos on the spectrum. Um, one of the things is this idea of limited choices, of that giving kids on the spectrum open-ended questions or saying you can do whatever you want. Overwhelming. Kiddos on the spectrum, A or B. Give them a limited set of choices and make it concrete. That's going to be much more doable and a easier lift for them. There's lots of resources, social stories, being able to unpack social situations in figurative language. Um, All right. So positive attributes. There are some, in fact, many. So both individuals with ADHD and ASD, that hyper focus can be really productive. And they both also both ADHD and ASD creativity and also seeing things from a different perspective. Like a lot of times kids with both with ADHD and ASD, they come up with really creative, outside of the box solutions that you're like, whoa, I would have never thought of that. So, seeing life differently can give us a lens that's really creative. Um, Again, kids with ADHD, they can make quick decisions, have a unique perspective, can think outside the box, be spontaneous, high energy, resilient, lots of pluses. Um, Individuals on the spectrum, really good at seeing the trees versus the forest. So any task that involves detail like that, um, kids on the spectrum can be wonderful with that. There's a lot of IT jobs that are just amazing that kids on the spectrum can do in a way that sometimes neurotypical individuals cannot. Working with data, they can see things different. They aren't distracted by the gestalt sometimes that many of us are. Um, they can take emotion out of a situation and be more objective, which can be incredibly helpful. That unwavering focus, again, they can have a unique set of problem solving strategies that really looks at things from a different lens. Efficient, can be honest, dedicated. So there are a lot of pluses with these kiddos who are neurotypical, I mean, neurodivergent. And I think we need to celebrate those and recognize those. Whew, I have gone through a lot. I have these resources. Again, I'd like to send you the slides just so you have the resources. And then finally, and we're going to get to questions, I'm just doing a really quick, and if you want to know more, just go to our website about the Sycamore School. And we serve students 5th through 12th grade who learn differently. And it's a mastery-based learning model. Learning is self-paced, engaging. We don't have tests or grades. And it's a really wonderful, small, inclusive community. So if you want to learn more, please reach out. And I want to turn it over to questions and maybe unshare my screen so people can kind of just, oh, we got a lot more people now. Um, so yes, I don't know if we want to.
Karen, we had one quick, thank you so much. Such a spectacular talk,
I know I went through so much, so I apologize, because
but
it was a lot.
such fabulous information for everybody. One parent, though, has asked in the chat, and please, everybody, put your questions in the chat if you'd like, or raise your hand. Somebody wants to know, is nail biting considered stimming?
Good question. Nail biting? It's It could be. I know an individual with ASD who has a real oral fixation, and so is always chewing on stuff, and we're actually having to curb the behavior of because they're putting things in their mouth that you shouldn't be ingesting. And so it's possible. Um, I mean, it's kind of more on that a lot of kids with ASD, or not a lot, some have OCD-like tendencies. So I wonder if the nail biting is actually, um, kind of more kind of like a compulsion,
Yeah,
depending on how often they're doing it. If like it's getting bloody and icky, it can be more of a compulsion. Um, Hope that's helpful.
I don't have any other questions in the chat, but does anybody else have a question? See, I told you it was such a thorough
Wow.
talk.
Wow. And I will say too, I didn't say this, but if you have not seen the Temple Grandin movie or have read any of Temple Grandin's books, I will say that's another amazing resource if you want to know more about individuals on the autism spectrum. It's amazing. And check out the resource. There's a lot of great resources out there to help parents and to help you navigate. First of all, parenting any child is a struggle. Struggle. I have 2 adult kids that now I'm I'm parenting, I'm helping them with adulting, but parenting anybody is difficult. And when your child's neurotypical, it can be, even more challenging. So please use the supports that you have. There's a ton of wonderful resources. This group obviously is a wonderful resource. There are lots of things out there that are free, and there are a lot of us that are really dedicated to supporting parents. So I just say use the resources that are out there and know that you're not alone and that we're all we're all doing the best that we can, and we want to help support each other. So
Erin, we do have one more question.
absolutely.
Someone wants to know if it's worth getting updated psychoed evaluations if the first one was done several years ago. She says this child is now 8. The first evaluation was at 5, and would supports change if the diagnosis was updated?
Sure. So my short answer is yes. But you have to be really careful where you go. Meaning you I recommend an independent evaluation versus getting it through your school system for a lot of reasons. And I will also say be strategic about getting an evaluation, meaning like I will recommend um to parents when your child is about ready to graduate high school, if you're looking for supports in college, you want to get an updated psycho ed or neuropsych that senior year because you want it to be within a year. And that's a whole other talk with that. There's lots of good people that do it that are about how to get supports for your individual in college. And sometimes it requires a current IEP and or psychoeducational testing. So again, you need to be strategic about when you're doing it. Sometimes entering high school is a great time, especially if your kid's going to take the SAT or the ACT in terms of supports and accommodations on that. You also can get that through your IEP. But I think it's also thinking about what is the evaluation? What's your purpose? What's your goal? Is it to get services? Is it because you don't have a clear diagnosis? I would also, if you have any therapist that you're working with, that's a good piece because I will often say parents, sometimes I'll say, yeah, a neuropsych or psycho ed would help, but in most cases for us, it's just confirming what we already know. So it depends on the case and what your goal is with it. I think an accurate diagnosis is incredibly important. Um, you just need to make sure if you're looking for an ADHD diagnosis, there's much bigger cross section of clinicians that are very adept. If you're looking for something possibly an ASD diagnosis, I will tell you, you need to go to the right clinician. um, and a lot of people will go through their insurance, and I understand that, but I've seen a lot of even it might be cheaper, but if you don't have an accurate diagnosis, it's worth nothing. So I just say that to say, go to somebody you trust and get a good referral if you're going to have testing done because you don't want to waste your money getting a bad evaluation. And unfortunately, I've seen that a lot. So I hope that answers your question.
And somebody else brought up that pediatricians are not the only group that can and should possibly be diagnosing.
No, 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 no. There are some wonderful, wonderful pediatricians that will flag things and are amazing. But there are also, I've had so many cases, pediatrician, first of all, the volume of kids that they see. And so if they see your kid for 15 minutes once a year and they're like, "Oh no, little Andy doesn't have ADHD." I'm sorry, they don't know. They don't no. A 15-minute visit, no. They're not going to be able to diagnose for ADHD. So you're right. No. Again, some pediatricians are incredible and will say, "Hey, I think something's going on. I think you should get your child evaluated." So they're great at flagging stuff, but I would not rely on your pediatrician to diagnose ASD or ADHD. Um, yeah. And so there are a lot of good clinicians around. Um, but yes, I've had that many times that a pediatrician will say, "Oh no, little Johnny doesn't have that." And it's like, little Johnny has not been at school with him all day and seen the things that we're seeing. And so it's also, it's the team. It's a team you surround yourself with. So teachers that you trust, clinicians that you trust, people that are going to help you support your child. And again, the pediatrician can be an important part of that team, but that shouldn't be your only source for a diagnosis.
And that's, at this point, it appears that's everything we have, unless we'll give it just a minute and somebody can chime in if they need to or want to. But otherwise, Karen, thank you so much.
My
Brilliant presentation, amazing information. This will be up on our YouTube channel shortly. And thank you for sending out the slides to everybody. And I'll just put in a pitch for Sycamore. If you want to see a phenomenal program, go visit this school. What they do with individualization for kids is phenomenal.
Thank you. And I am seeing another question. Am I aware of any real life social skills classes for teens and tweens? Yes, absolutely. And Kathy, they might know. I mean, I'm just going to plug like social
Yeah.
grace, was my first
Yeah,
thought.
plug
It's
them. Yes.
fantastic. But there's several places that are very good at working with social skills and doing really applied real life situations, getting kids out into the community. And like say, social grace is one of them that I highly recommend. But I
They're
bet
in Arlington.
they're in Arlington, but I bet we have some people here who maybe know some Maryland and some other places as well. But my short answer is yes. And it can really be a game changer
Yes.
for sure. Anything
And it
else?
seems